Welcome to another edition of Facebook Live. I'm David Olajars, Manager of Media Relations at Henry Ford Health System. Today we're talking about the COVID vaccine, our best hope at ending this pandemic, which is now in its 12th month since the first case of COVID was confirmed here in the United States. The first case in Michigan was in March. I'm pleased to introduce our guest for today's discussion. Please welcome Dr. Dennis Cunningham, the Medical Director of Infection Control and Prevention at Henry Ford, and Dr. Kellie McFarlin, a Henry Ford General Surgeon, who was also a vaccine participant in the Moderna vaccine trial. Welcome to you all.
Thank you so much.
For our viewers, be sure to read the disclaimer at the top of this thread. Dr. Cunningham, I'd like to begin with you. This week, the UK became the first country in the West to approve Pfizer's vaccine, and they plan to start vaccinating people there as early as next week. In the United States, the FDA is expected to decide whether to approve the Pfizer and the Moderna vaccines for emergency use as early as next week. Typically, we know vaccines take years to develop. Yet here we are on the cusp of approving not one, but two vaccines in less than a year. From your perspective, how do you view this, and how should the community at large view this?
I think this is an overwhelmingly positive finding. When we go back, think about HIV, how many years it took us to even find what the virus was and get tests to know what it was and to start treating it. It's now amazing that in a matter of weeks to less than a month, we can identify a new virus. We can genetically sequence it so we know the building blocks that encode this virus and that we can make a vaccine. So I think it's really thrilled. This has been a fast progression, but the nice part is the science is very sound. The standard phases of vaccine trials have gone through where you start with a small group, gradually increase it. And I'm really excited to see the final publications of the phase 3 safety, which is the last stage of a vaccine trial before it's approved. But the preliminary data that I saw in a CDC presentation earlier this week is phenomenal.
Dr. McFarlin, at the time you enrolled in the Moderna trial, were you at all concerned about how fast the vaccine process was moving? Dr. McFarlin, can you hear me? Can you, are you on mute, Dr. McFarlin?
Yes, hi, I can,
Are you good?
thank you, I can finally hear you now.
All right,
No, I wasn't too concerned about the speed. No, I'm on.
Okay.
Unmuted.
Okay.
I'm here.
Were
No,
you
I
at
was
all
saying that
concerned
at the
about at the time you enrolled in the study? Were you at all concerned about how fast everything was moving?
No, because I was keeping up with the news reports and literature, and I knew that once we reached the phase 3 trial, a lot of safety concerns had been addressed, and so I didn't have the concerns for the speed. I was pretty excited about the speed things were going.
Okay. Dr. Cunningham, at last count, there are like 13 vaccines at the phase 3 clinical trial stage. Is there a benefit to having so many vaccine candidates in the pipeline?
I think there is, because not all the vaccines are using the same technology or basis for production. Both the Pfizer and Moderna vaccines, which I expect the FDA will approve very soon, are using messenger RNA technology. It's been around a while. There's another big vaccine, AstraZeneca, in conjunction with Oxford, has a different vaccine candidate. That one doesn't look like it's quite as effective in their trials, but there's still some protection from it. And that's actually using a viral vector to trigger the immune response in people who get the vaccine. I think the Pfizer and Moderna vaccines are using the better technology. When you first start out making a new vaccine or new medication, you have to try several approaches to find the best vaccine, because there's no guarantee ahead of time how it's going to work out. So you need investigators looking in different areas, and then you take whatever is the best. And we're fortunate that the Pfizer and Moderna vaccines, I mean, 95% efficacy for a vaccine is amazing. That is a success story in my book. So I think we're very fortunate.
Could you walk us through the different stages, Dr. Cunningham, of a clinical trial?
Sure. So first, things are usually tested in labs and then in small animal groups, because we want to make sure it's safe to go on volunteers. There's 4 phases. The first, you give a small group of people the vaccine and you're looking for safety. You want to make sure you're not hurting people. And again, this is done after animal studies to make sure we're pretty confident it's not going to cause harm. Phase 2, you increase the number. So maybe you went from 20 to 100 people in phase 2. You could even do more than that. And there, again, you're looking for safety, but this is when we look to see, does the vaccine trigger an immune response? If those 2 phases go well, you go to phase 3. This is where it's thousands of people. For Pfizer's vaccine, I think they had something like 46,000 volunteers in phase 3. They give half the people placebo, which is just a shot of saline, which doesn't do anything, and then they compare it to the vaccine candidate. And in this trial, they're looking again for safety and especially at the immune response. If phase 3 data looks good, they get approval from the Food and Drug Administration. We then go into phase 4. This is post-marketing. The US has surveillance systems in place to identify any rare or unusual vaccine side effects. So from now on, it'll be phase 4 after the FDA approves it, where we're always going to have public health looking for any problems. But that's really the concise summary of how vaccines are studied.
And who regulates clinical trials in the United States, and how might that be different than in like Europe, for example?
So in the United States, we have the Food and Drug Administration. They have to approve any investigational new drug or medical device, and a vaccine would be considered an investigational new drug. Along with FDA approval, any institution, university, hospital that's doing research, we have institutional review boards. Their job is to look at the proposed research and say, is this safe for the volunteers? Is this reasonable? Europe is fairly similar. They don't use the FDA. They have a different European Commission for pharmaceutical approvals, but the science and the basic story is the same no matter where you are.
I'd like to turn to the Johnson & Johnson vaccine trial that we have going on right now. Dr. Cunningham, can people still enroll? And can you talk a little bit about the specific criteria that's in place for participants?
So the J&J trial, I am not involved in that one. I would not be the best person to provide advice on that. I don't want to give information if I'm not sure of accuracy.
Okay, got it. Moving to this week's decision by the advisory panel of the CDC. And that panel recommended that healthcare workers and residents of nursing homes and long-term care facilities would be first to receive any vaccine that's approved. And I would think that most people would agree with that guidance, right? Dr. Cunningham, can you talk about why it's important for healthcare workers to be vaccinated? And even more broadly, why is their participation important in various trials?
Well, as healthcare workers, we understand medicine. We understand the science behind vaccines. We understand what a powerful preventive medicine tool they are. We also have to look at the surge in this country, and cases are increasing, probably in part because of Thanksgiving travel and get-togethers. We want to make sure that we have employees who are healthy and able to work at the hospital to provide care to the communities that we serve. We want everyone to know when you come to our hospitals or our clinics that we're here providing the usual care that we always do, which I think is quite good. The vaccine is going to help keep our employees and our doctors and our nurses and many other people safe and healthy so that they can continue to work and do all this important care we do on a daily basis.
Dr. McFarlin, when you made the decision to enroll in the Moderna trial, what was that decision like for you? Dr. McFarlin, can you hear me? Dr. Cunningham.
So when I decided, I read about the study. Yes, I'm here. Can you hear me?
Yep.
Yes.
Yep, go ahead. Thank you.
I can hear you. Can you hear me?
Yes. Yep, go ahead.
I can hear you.
Okay, perfect. Go ahead. Yes, you're
Can
fine.
you hear me?
Yes.
Okay, thank you. Oh, thank you. When I decided to enroll in the trial, I read about how they were conducting the study. I thought about my role as a mom and a surgeon, what impact it could have on me and my family. And I felt comfortable proceeding and thinking it would, if I did get the vaccine, it could be protective. And if I was part of the placebo group, at least it was adding data to the study to help my community, because of I want to be represented in the trial as African American, so that I know that the data is pertinent to people in my community as well.
Have any of your patients or family members or other friends of yours, Dr. McFarlin, have they followed your lead into enrolling in one of the vaccine trials?
I have colleagues who have also enrolled in a trial. I haven't had any family members follow yet, just because I think they just have some apprehension about joining the trial, and so I tried to explain my rationale, and now they understand it. But in the beginning, it was sort of me just deciding and going ahead to enroll.
So we know that African Americans represent about 12% of the population, but only 5% of clinical trial participation. Hispanics, meanwhile, make up 16% of the population and 1% of clinical trial participation. Dr. Cunningham, can you talk about why it's important for minorities to be participating in vaccine trials?
Absolutely. So we're all people, we're all humans, no doubt about it. Sometimes there can be some genetic traits that are more prevalent in one group than another. And sometimes that can also impact how we respond to medicine or vaccines. Different groups may metabolize or process a medicine differently. Their immune system might be a little different. So if I do a vaccine trial and I have all the same group, I'm confident about the results in that one group, but I want to make sure this is going to work for any of my patients, for anyone in the community. So that's why I salute the people who volunteer for these trials. It's absolutely necessary to make progress, but I love the fact when you have different groups represented, because then we have a microcosm of what this country is like, and we can give some better idea for all groups. Is this vaccine going to work for you? We want it to be fair and equitable for everybody, and this is how we get that data to make sure we're doing the best for everyone.
Dr. McFarlin, any thoughts? Your thoughts, Dr. McFarlin? Dr. McFarlin, your thoughts on minorities participating in vaccine trials? The importance of them? I think we have a little technical glitch here. Turning to you, Dr. Cunningham. So with any kind of clinical trial, whether it's vaccine or a medicine being tested, the safety of the participants is very important. The most important, part of a clinical trial. What are the steps being taken then to protect the enrollees in a vaccine trial?
So I mentioned these institutional review boards make sure the research is reasonable and that the risk is very reasonable. We don't want people to do things that we know are going to be dangerous. When you enroll in a trial for any medication or vaccine, usually we get baseline blood work just to make sure your body's working well. We want to make sure you're healthy. There may be a quick physical screen or exam. During the trial, we get periodic blood work. For instance, we might check some liver enzymes, make sure you're not having any liver problems after vaccine, or your blood counts. And along with that, we tend to measure the effect we're looking for. In this case, would probably be antibodies against COVID, the virus. The antibodies are proteins that give us immune protection. And there's also an ethical obligation. If we learn anything that is a new risk, or we found out some data that could potentially hurt someone, we have an obligation to let volunteers in these trials know right away. And that's absolutely a requirement of research in this country. We really try to not do any harm. That's our motto.
We have a couple questions from our viewers. This one from Kathleen, and Dr. Cunningham, if you could take this one. Kathleen is asking if you had COVID and have antibodies, do you still need a vaccine?
So right now, we don't know how long people have protection, or these antibodies are going to protect people after natural infection. The question is, will the vaccine give us longer protection? We're going to have to look at this data long term. Some volunteers will have work drawn periodically to answer that question. There's no evidence that if you were infected, you get the vaccine, it's going to hurt you, but we don't yet have enough data to say whether or not it's going to offer you any benefit.
And this question comes from Jack. He had quadruple bypass 3 years ago. He had some health-related issues. He's obviously quite nervous about receiving a vaccine. When a vaccine becomes available, he's asking, should he consider it given the potential side effects?
So everything we do in medicine, it's what's the risk, what's the benefit? So you have to look at what's your risk of getting COVID. Right now in this country, it's fairly high. And we know it can cause harm, especially in people with medical problems. So there's a risk with anything, but the vaccine's benefit is potentially will keep you from getting this virus, or if you even get the virus, it might make it a more mild illness. So this is where it's so important for people to talk with their healthcare provider. They can help tell you what is your individual risk based on your medical history for complications of COVID versus the possible benefit. And it's really something that each patient needs to decide for themselves, or parents in the case of children. But I would urge them to at least have that conversation with your primary care provider or the specialist who cares for you, so that you have an understanding of the facts. It's going to be your decision to make. I just want you to have the right information for you to consider and make the best decision for yourself.
You talked a little bit about the two vaccines. Can we get into some specifics between the Pfizer and the Moderna ones, in terms of what they are and the uniqueness of having to be stored at frigid temperatures?
Right. The Pfizer vaccine has to be stored especially super low temperatures, -90 degrees Fahrenheit. Obviously, your typical freezer never gets anywhere near that temperature. Once you mix up the vaccine, you prepare it, you can use it within a few hours if it's kept refrigerated. They're both using the same technology, where it's called messenger RNA technology. You inject this messenger RNA into the body, your cells see it, and they will make the proteins for the virus's outer shape, the shell, the proteins on there, and that triggers your immune response. So they're both similar in that. There's slight differences in them. One vaccine you give 2 doses separated by 3 weeks, the second one, you separate the 2 doses by 4 weeks, but both of them are remarkably similar. We're talking about 95% efficacy, which means if I vaccinate 100 people, 95 of them seem to get good protection after the vaccine based on the initial studies. That's a phenomenal rate for any vaccine. And I don't know that there's going to be much difference between the 2 vaccines. We'll see over time, but the preliminary data looks pretty similar.
Now, is it fair to say, Dr. Cunningham, that when I go get my vaccine, and let's say I get the first one with the Pfizer vaccine. And then 2 or 3 weeks later, when I go back for my booster, I cannot ask for the Moderna one, right?
So we would, right now, the recommendation is you stick with whichever brand you've got. So if you start with Pfizer, get 2 Pfizer doses. For Moderna, 2 Moderna doses. For vaccines other than COVID, there's some ability to switch between brands and still get protection. We don't have this data yet for COVID, which is why the CDC and other advisory groups are making a very prudent recommendation. Get 2 doses of the same vaccine. Then we can use the data from these different clinical trials and give an idea that we can expect you're going to be protected.
Let's go back to some of our viewer questions. This one comes from Warnick, who says, with having pre-existing conditions, I'm concerned of catching the COVID virus from the vaccine. Is there any truth to that, Dr. Cunningham?
There's no live virus in this. If you get the vaccine, doesn't contain the virus. You're not going to give it to anyone else who you're around. So it's very different than some of the live vaccines like chickenpox or measles, where there is a weekend but live virus. This is a completely different vaccine. It's more inactivated, where it'll trigger the proteins of this virus, but it's not going to actually give you the virus that can grow and divide and be spread to other people.
And we don't know yet whether this vaccine will become an annual one or whether it will have more long-term immunity to it, right?
That's correct. I can tell you there's a couple similar coronaviruses to COVID-19, Mediterranean Middle East respiratory syndrome virus, and then the original SARS. Those give you good protection, it looks like, for at least 2 to 3 years. So I'm hopeful the vaccine will at least do that. It's going to take these trials going on longer to know if we're going to need a booster dose in the future. That we'll have to wait and see.
And this question comes from Tom, asking about, are there any vaccines being investigated for children?
So these vaccines, there are some trials that are looking for this in children as well. Typically, we do vaccine studies in adults first, and then it's moved to children. Occasionally, you'll do the study first in children if it's a childhood disease, but right now they'll be adults first.
In terms of how vaccine gets allocated and distributed, that's a question that we've been hearing a lot over the past couple of weeks. Can you talk about who decides how much vaccine the state of Michigan will receive and how it's allocated across the state?
So partly this is dictated by the federal government. The federal government has bought the Pfizer and Moderna vaccines, and they will distribute them. So they have a formula, and based on population, they say this many doses will go to Michigan, this many doses might go to Illinois. And then the state has a lot of influence in terms of which health systems do they want to send it to first and how they plan on spreading it out. The initial health systems like Henry Ford that are receiving the vaccine tend to be big institutions. We have the resources for these industrial freezers, and we can start the process. And you'll see, I believe, a pretty quickly ramped up distribution of vaccines so that other people can get it. On an advisory committee on immunization practice meeting on Tuesday, which we referenced earlier, it is the hope that by March we'll be able to offer the vaccine to anyone who wants it, which would really be miraculous if it's approved in December within 3 or 4 months to be able to do that. That is truly a triumph of medicine.
And whenever I receive my vaccine, Dr. Cunningham, does this mean that I can then stop wearing my mask, stop social distancing, stop hand washing? You know, what about all those safety measures that we've been practicing now for months and months? Do those stop at the point where we get vaccinated?
So the recommendation that already has come out from the Centers for Disease Control and Prevention is continue wearing the mask, continue to social distance, limit your exposure, and always wash hands. That's going to protect you not only against COVID, but other respiratory viruses and infections like flu. Additionally, I mentioned that this is 95% effective from the preliminary data. That means 1 in 20 people may still be susceptible. So I'm glad that the vaccine is going to give me 95% protection, but there's still a 5% chance I could get infected. I'd rather not. It's also very hard if some people are wearing a mask and some aren't. How do you know if someone really had the vaccine or not? I think for all those reasons, it's probably safer for everyone to do this. And then once we get to a critical number of people who have been infected or vaccinated, then I really hope and pray we'll go back to our lives as we knew it before COVID.
You referenced the early data from those two vaccines. When the updated information becomes available, is there anything specific that you're going to be looking for in that fresh data, Dr. Cunningham?
Certainly. So the things and there was a little tease of this information, almost like a movie trailer at the Tuesday meeting, which was fascinating. But it was really, what I want to see is the safety data. Did people have side effects? What kind of side effects? How severe they were? Were there any serious issues after vaccination? And then probably the next most important question is, what's the immunity like? How many antibodies did people get at what level or quantity? If it's the right antibody in sufficient numbers, those proteins are going to destroy the virus and give you protection. And that's really, to me, the most exciting piece of data I want. The safety data is also equally important, but I'm excited to know how well the vaccine works.
Dr. McFarlin, welcome back. Once the vaccine is approved,
Thank you.
Once the vaccine is approved, Dr. McFarlin, are you going to receive it?
Yes, I would. I mean, I guess I hope I would know that I did it already or not, but if I hadn't, I definitely would receive an approved vaccine.
And Dr. Cunningham, your thoughts on that?
I will receive the vaccine as soon as my group is eligible. I'm not working in the emergency department or intensive care unit, which would be priority areas with the sickest patients, and they're doing procedures that can spread the virus into the air, like putting in breathing tubes. But when my group is eligible, I will gladly get to the front of the line. I don't want to cut anyone off, but I'll be excited to get mine.
We have a question here from Michelle. She's asking, can we safely conclude from the current data that the long-term effects of the new vaccine will be minimal, even though we don't have long-term data looking at long-term side effects?
So generally with vaccines, you're going to get the bulk of any side effects or adverse reactions relatively soon after vaccination. It becomes a lot less likely you're going to have problems years or decades later. And I'm not anticipating those problems, but as I mentioned before, that's why we have these phase 4 post-approval studies or monitoring, just to make sure everything's going well. Everyone's committed to the safety here, and we certainly want to make sure it's safe, but I'm pretty optimistic that this data is exciting and looks very, very promising from what I've seen so far.
So before we wrap it up here, I'd like to ask each of you for a closing take-home message. Dr. McFarlin, would you go first, please?
Yes. My take-home message is just to have everyone be mindful and safe and continue to follow social distancing and wearing their mask. My twins are 4, and I was telling them about how, Hawaii is such a beautiful place and we should go and visit and have fun on the beach. And my one daughter looked at me and said, "Mom, there's a virus outside." And I had to stop and say, okay, after the virus is under control, then maybe we can go do something like that. And it really took me a moment to realize she was shocked that I said that we should do that when there's a virus outside. So I was really happy that she understood what was going on and knows about washing hands and wearing their mask when they're out.
Dr. Cunningham?
I want everyone to stay safe. That includes what we talked about: masks, hand washing, social distancing. People should eat well, get enough sleep. We know that can also have an impact on the immune system. We will get through this. I'm really hopeful that by spring, we're going to be out of the woods and heading back to normal life. And I think all of us would agree that would be awesome.
Well, thank you both for your thoughtful comments and your insight today. We also want to thank our viewers on Facebook for watching and for your questions. For additional information about the COVID vaccine, please go to henryford.com. We have a resource there called Your Top 10 Questions Answered. For more information about the Johnson & Johnson vaccine, you can go to henryford.com/J&J vaccine. Thanks everybody for watching. Please be safe out there. Make sure you wear your mask, social distance, wash your hands, and we'll see you next time. Bye now.
Bye.